Somewhere in your medicine cabinet right now, there is very likely a pill you take without a second thought. Something for sleep, for allergies, for blood pressure, for heartburn. That research has quietly linked to memory loss. Not because it's dangerous in the way a warning label usually means. Because almost nobody, including many doctors juggling a 10-minute appointment, is looking at it that way. I'm not going to tell you to panic. I'm going to tell you exactly what to look for and exactly what to ask your doctor. Because the fix here isn't fear. It's a 5-minute conversation you may have never thought to have. Here's why this stays hidden for years. These medications don't cause dramatic side effects. They cause slow, subtle fog, the kind that gets blamed on aging, on stress, on a bad night's sleep. Nobody connects a decade of taking the same pill to the memory changes that show up gradually in the background until someone finally asks the right question. Before I go any further, I need to say this clearly because it matters more in this video than almost any other. Nothing you're about to hear is a reason to stop taking any medication on your own. Some of these, stopped suddenly, can be far more dangerous than the memory concerns we're discussing. This video is not permission to quit a prescription. It's a list of questions to bring to your doctor or pharmacist. Keep that in mind as we go. By the end of this video, I'll walk you through the medication on this list that gets blamed the most online, and the one where the actual evidence tells a very different story than the headlines. If you've ever been afraid of one specific medication because of something you read, stay until the end, because you may be worried about the wrong thing entirely. Quickly, I'm Dr. William Mercer. I've spent years reviewing cardiovascular and general medical research and translating it into something people can actually use without the fear-based headlines. I'm not selling anything here. No supplement, no program. My only job today is to walk you through what the research actually says about these 5 medication categories, plainly and honestly. Let's get into it. Here's the one concept that ties almost this entire video together, a brain chemical called acetylcholine. Acetylcholine is one of the main messengers your brain uses to form and store new memories. Think of it as the ink your brain writes with. A whole category of medications, called Anticholinergics, work by blocking that exact chemical, usually to treat something completely unrelated, like allergies or an overactive bladder. Block the ink, and the writing gets harder to read, sometimes just for a few hours, but with heavy long-term use, research suggests the effect can build. One word to hold on to, acetylcholine. You'll hear it again in a minute. Let's start with the one almost everyone has taken at some point, usually without a second thought. This includes both benzodiazepines, medications like alprazolam or diazepam, and the newer Z-drug sleep aids like zolpidem. They work by boosting a calming brain chemical called GABA, which quiets down brain activity. That's exactly what helps you fall asleep. But your brain does a lot of its memory filing work overnight, while you sleep, and quieting the whole system down can interrupt that filing process. It's a bit like hitting pause on a recording that's still trying to save. Picture a woman I'll call Grace, a composite of patients I've seen many times, mid-70s. Took the same sleep medication nightly for close to 8 years, never questioned it because it worked. Her daughter started noticing she seemed foggier during the day, more repetitive in conversation. Nobody had connected it to the pill on her nightstand because it had been part of her routine for so long it had become invisible. Here's where most people make a mistake. They assume a medication that's been fine for years is automatically still fine today, especially as the body ages and processes these drugs more slowly. That assumption is exactly what needs revisiting, with your doctor, not on your own, since stopping some of these suddenly can cause serious withdrawal effects. One sentence to remember: a pill that helped you sleep for years deserves a second look, not permanent trust. Now here's the one that hides in places you'd never think to check. Remember acetylcholine, the memory ink from a minute ago? This category blocks it directly. And it's not just prescription medication, it's often sitting in your regular drugstore aisle. Diphenhydramine, the active ingredient in many nighttime allergy pills and PM sleep aids, is one of the most common anticholinergics people take without ever realizing it. So are certain bladder control medications and some older antidepressants. Research following large groups of older adults over time, including a well-known study published in a major internal medicine journal, found that heavier, longer-term cumulative use of strong anticholinergic medications was associated with a meaningfully higher risk of cognitive decline. The key word there is cumulative. This is about years of regular use, not a single allergy pill during hay fever season. I think of a man I'll call Frank, late 60s. Took a nightly allergy pill for a decade because it doubled as a sleep aid. Never once mentioned it at his checkups, because in his mind, it was just an allergy pill, not a medication that touched his brain. What most people do wrong here is exactly that. They don't mention over-the-counter medications to their doctor at all, because they don't think of them as real medications. One sentence to remember. If it blocks your allergies, it may also be quietly blocking your memory ink. Now, this next one, I want to introduce carefully, because I don't want you to hear it the wrong way. Some blood pressure medications, particularly certain beta blockers that are able to cross into the brain more easily than others, have been associated in some research with brain fog, fatigue, and memory complaints. But here's the part I need you to hear clearly. Uncontrolled blood pressure is, by a wide margin, more dangerous to your brain than these medications are. High blood pressure is itself a major cause of vascular damage and memory decline. This is never a reason to stop your blood pressure medication. What it is a reason for is a conversation. Some patients working with their doctor are switched to a different medication in the same class that doesn't cross into the brain as easily, and notice real improvement in mental clarity, with their blood pressure just as well controlled. That's a doctor-guided decision, never a do-it-yourself one, since stopping blood pressure medication abruptly can be genuinely dangerous. One sentence to remember: the goal is never fewer blood pressure pills, it's the right blood pressure pill. Let's lock in what we've covered before moving into the second half. Category 1. Sleep and anxiety medications, quieting the brain so much it interrupts overnight memory filing. Category 2. Everyday anticholinergics, often hiding in plain sight in allergy and bladder medications, blocking your brain's memory ink. Category 3. Certain blood pressure medications, where the real answer is almost never stop. It's ask about alternatives. Notice a theme yet? None of these are about panic. All of them are about awareness. Quick myth to clear up, because it applies to everything left in this video. Myth: if a medication is linked to memory issues in a study, you should stop taking it right away. Fact: an association in a study is not the same as proof that the medication caused the problem in you specifically. And for many of these drugs, stopping suddenly carries its own serious risks. The right response to this video is a conversation with your doctor, not a decision made alone tonight. Here's something I haven't told you yet. The next two are, in very different ways, the most surprising ones on this list. One because almost nobody suspects it, and one because almost everybody wrongly does. Proton pump inhibitors, common heartburn and acid reflux medications, reduce stomach acid. That's the whole point, and it works well. But stomach acid also plays a role in helping your body absorb vitamin B12, and B12 deficiency is a well-established, well-documented cause of memory problems and cognitive fog, especially in older adults who already absorb B12 less efficiently to begin with. It's not that the medication attacks your brain directly, it's more like it quietly closes a side door your body needed to keep a nutrient your brain depends on. What most people do wrong: they take these medications for years, often started for a short-term problem that became permanent by default, without ever getting their B12 levels checked. One sentence to remember: sometimes the memory problem isn't the medication itself, it's what the medication is quietly taking away. And now, the one I promised you at the start of this video, the medication that gets blamed the most and deserves it the least. Cholesterol-lowering statins picked up a reputation for causing memory loss after some patients reported it years ago, which led to a cautionary note being added to their labeling. But here's what most people never hear. Larger, more rigorous studies since then have generally not confirmed a strong causal link, and some research actually suggests statins may lower the risk of dementia overall, likely by protecting blood vessels and reducing stroke risk, both of which matter enormously for long-term brain health. I think of a patient I'll call Walter, who nearly stopped his statin cold after reading an alarming article online without telling his doctor. When he finally brought it up at his next appointment, his doctor walked him through exactly what I just told you, and Walter stayed on his medication. His heart, quite literally, thanked him for it. What most people do wrong with this one specifically, they stop it based on a headline, never a conversation, which trades a debated, unproven risk for a very real and well-established one. One sentence to remember: don't let the most feared medication on this list be the one with the least evidence against it. Here's what matters more than memorizing 5 categories. This usually isn't about one pill. It's about total cumulative exposure. How many of these you're taking together, and for how long. Doctors and pharmacists call this a medication review, and it's one of the simplest, most underused tools in aging well. One pill from this list is rarely the whole story. Several of them, stacked for years, is a very different conversation. Before you go, picture one specific person. Maybe it's a parent who's been on the same handful of prescriptions for 15 years and hasn't had them reviewed together in just as long. Maybe it's a spouse who takes an over-the-counter sleep aid every single night without thinking twice. Send them this video. Not for the channel, because it might be the exact nudge that gets them to ask their doctor for a full medication review. Something as simple as bringing every bottle in for a pharmacist to look at together. Before you go, how many of these 5 categories are you or someone you love currently taking? Just drop the number in the comments. I read every single one. One last time, because it matters most in this video, everything here is for educational purposes. It is not a diagnosis, and it is absolutely not a reason to change, reduce, or stop any medication on your own. Some of these carry real risks if stopped suddenly. Please bring this list to your own doctor or pharmacist and let them guide any changes. My goal will always be the same: real research, translated plainly, so you can have better conversations with the people actually treating you. You don't need to throw out your medicine cabinet. You just need one honest conversation with your doctor or pharmacist about everything in it. Ask for a full medication review. That's the whole action, and it might be the most important 5 minutes you spend all year. Take care of yourself, and I'll see you in the next one.